Hey, everybody, welcome. Today, we're going to be talking about how to start fixing your hormone imbalances naturally. And as my motto would be, go big or go home. Hey, everybody, I'm Maggie Yu, functional and holistic medicine physician and the creator of the Transform protocol to transform your autoimmune disease naturally and your hormones naturally. Today, we are talking and following up on hot topic around hormone imbalances. And I hope you guys didn't miss last week's training that we did around what are some symptoms that you have that are actually hormone related. What is a checklist for hormone imbalances at any age for women and for men? So I went through that in exquisite detail last week. And those of you who are watching this week, if you want the checklist, go ahead and write checklist in chat right now in the comment section and check your message request in a couple hours, and our team will get you the checklist to you because really importantly, you got to know if your hormones are jacked up or not in the first place, right? And anybody who've been through our programs also know that. Many people through my hormone masterclass, which is our transform your hormone program that people do, have learned that by turning around their hormones, they can see some big results in a really short period of time, right? But people also know in our transform autoimmune program that hormone transformation is one of the biggest pillars of transform. It's one of our 5 pillars, in fact. And they also know that that hormone pillar is connected with all the other pillars of transform. So hormones is not a little deal. It's kind of a big thing. And it's kind of a big Dr. Maggie Yu thing because it's a huge part of my own journey. Today, what we're going to talk about, we're going to jump right in, is we're going to talk about how do you get started? You have done the checklist, okay? And many of you are already typing you want the checklist. If you want the checklist, type checklist in chat and check your message request. A couple hours later, our team will get back to you. Get the checklist, right? You've done the checklist. You know your hormones are jacked. And many of you already know that it's triggering and feeding your autoimmunity. So, how the hell do you get started in dealing with it? Well, yeah, there's a lot to unpack there, right? I could write it literally as a master's degree and how to turn around hormones naturally because there's a lot of, intricacies to it. But I'm going to jump right in on this topic today, which is what are some natural supplements that you can start to kick some hormonal ass? Remember, I said go big or go home. So for me, I can highlight for you that I have a whole list of supplements that are really great for starting to balance your hormones. And if you want the whole starter list of how to balance your hormones, type me in chat with an exclamation mark at the end. Make sure you type the exclamation mark in the end because go big or go home. I want to know you really want the whole list of how to turn around your hormones. So the starter pack, what are some starter supplements that really will start turning around your hormones today? You want the whole list? Type me with an exclamation mark in chat. And those of you that are watching from YouTube, welcome YouTube. And thanks for commenting in YouTube as well. What I want to highlight is one of the items that we always talk about is in our store, and it's called Love Her. And we can provide the link to our store below if you're interested. But for me, it's really important for you to get educated. So get the guide. So make sure you type me with exclamation mark to get the guide. But you can find these products at the link to our store, which you will see in the comment section below. This product specifically is called Love Her. But what makes Love Her so lovable, and why does everybody, regardless whether you're a man or woman, why is this the supplement? What ingredients are in it that naturally is the best starting place for turning around your hormones? Well, literally, the ingredients list is long because I figured out what are some of the things that work really well together. So it's not like just one supplement alone, it's the combination of certain supplements that work really well together. But what exactly is in Love Her that really kicks ass? Here's for your education. Number one is DIM. DIM is actually a naturally occurring compound that is in a lot of what we call cruciferous vegetables. DIM is super helpful in decreasing the amount of harmful estrogens that are in your body. That's why a lot of people, when I talk about not just supplements, but even food, what is the number one food that you can eat to help balance any hormone problem around naturally is foods that contain a high amount of DIM. And that would be cruciferous vegetables, would be things like broccoli, cauliflower, Brussels sprouts. Those would be definitely, and there's a whole long list. People in our program who's been eating a ton of cruciferous vegetables, tell people your results. Next ingredient that I'd like to talk about in it is something called calcium D-glucarate. Calcium D-glucarate, just to give you guys a little medical background on this, is hormones are really broken down first phase in your liver. Second phase is going to be in your large intestine. And you got to have both steps working to really break down the hormones, break it down further, bind it, and carry it out. Basically, I think about it that way. So I think of certain supplements like DIM and turmeric and Chaste as helping the liver out quite a bit. And I see calcium D-glucarate as what helps the large intestine parts of it to get it out of your poo-poo. Okay. So that is an important ingredient, which is calcium D-glucarate, which is what is an powerful ingredient in liver. Now, who doesn't need help with her gut or his gut? A lot of you, when you did the checklist, learned that hormone imbalances involved a lot of people with IBS symptoms, chronic constipation, diarrhea, gas, bloating, right? So, absolutely, you want supplements that contain calcium D-glucarate in it to help some of these hormones to help the gut out, because calcium D-glucarate really helps the gut bacteria, which is doing the bulk of the work in the large intestine to break down those hormones further and take it out with them. So that's a really important ingredient in liver is the calcium D-glucarate. Also, we got chaste tree. Chaste tree is in there. Some people know the name of chaste tree as Vitex. A lot of these herbs, naturopathic physicians have used, right? And chaste tree is really good for helping with progesterone balance. We need some healthy levels of progesterone to combat these issues with too high estrogen or even people with low testosterone. Having some healthy balance of healthy progesterone production is really helpful. Chaste tree is really helpful in that. That's why Love Her is actually the number one supplement that we have in the store. It's the best thing to actually start with is Love Her. Whether, and that's just for men, women of any stage. When you did that checklist, if you checked positive at any age with a hormone imbalance, Love Her is going to work for you great. And men for any of those hormonal imbalance, men need the same breakdown in excess estrogen, same improvement in progesterone balance, same help in their gut to help carry out excess estrogens as well. So Love Her is great as a starting supplement for men and women at any age with any hormone imbalance. That's why it's in the starter bundle I recommend, right? Now, the other cornerstone of hormone imbalance, a lot of you guys who've been through my trainings on the 5 pillars to transform, which is the pillars of how to turn around any autoimmune disease naturally, knows that yes, hormone balance is one big pillar. But the second biggest pillar is da, 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 is blood sugar balance. Okay. So, blood sugar balance is one of the biggest reasons why hormones get jacked up, and people in our programs know why. Okay. Blood sugar and hormone balance are totally linked hand in hand. Okay. And I always say this, if all it takes is cutting sugar and you calling it good, none of you need me. Okay. But that really isn't the problem. The problem is that it's not about like just cutting sugar. I tell people that blood sugar fluctuates up and down like crazy, especially for those people with autoimmunity. And there are reasons for that. And this fluctuation, the rate of change from high to low hormones, low to high hormones, and high and low blood sugar and low and high blood sugar, these swings in blood sugar and these swings in hormones is what is triggering autoimmune disease. Booyah. And so, what I'd like to do is just go over why Balancer is a supplement that you can get started with. That's really the cornerstone of hormone balance as well. It's the cornerstone of hormone balance because when you look at what are the ingredients in the supplement and why do they work so well together? Well, if you look at the ingredients, number one is berberine. And number two is EGCG decaffeinated green tea. What is it about green tea and berberine that's so freaking awesome for hormones and for blood sugar? Well, first of all, when you're talking about berberine, berberine is incredible for blood sugar balancing. And in fact, we call it, a lot of us functional medicine physicians call it nature's metformin. Metformin is a medication that we use for diabetes a lot to help balance blood sugar. But metformin, while it's great, has some really big downsides. Like it depletes B12, which is really crucial for so many things. So berberine actually has a lot of the same mechanisms as metformin, which means that it really effectively stabilizes blood sugar naturally. Okay. Without a drug, without depleting you of other vitamins. And berberine is known to have a ton of Balancer has the berberine in there, but it also has the kick-ass secret ingredient, which is EGCG, which is the activated form of green tea. We use a decaffeinated green tea extract in there that contains a very highly strong concentration of EGCG. What is EGCG so good for? Well, it's really great for blood sugar balancing. Yes, there it is. We talked about that. cravings for sugar. That's why a lot of people will use green tea to help with trying to do weight loss. It's part of the mechanism is just stabilizing your cravings and blood sugar. EGCG is really helpful also sometimes for dealing with some of these more, it's anti-inflammatory. So, and it can be helpful for people with testosterone imbalances. So, especially people with a lot of acne type symptoms, oily skin, hair loss, even like a lot of sugar cravings, a lot of gut symptoms. That's somebody that really needs a lot of help with the blood sugar component with the hormone balancing. Balancer is great, and Balancer and Lover work really well together. And both of those is two a day, right? So how much easier can you get than that? So those are the two mainstays of like the two of the probably five starter things that I think are incredible to balance hormones that every woman at any age should be taking. If you have any hormonal imbalances, Lover and Balancer. Of course, there's a bunch of other things that I do recommend if you want the whole list to type me in chat right now with an exclamation mark behind it, right? Many of you have been going to doctors and going to say, I know, please check my hormones, or I know these symptoms are connected to my hormones. And what I want to point out is that doctors really don't know how to check your hormones properly. And if they don't know how to check your hormone properly, you don't know how to do it. So, really importantly, number one, step one in hormone balancing is get your hormones checked. Okay. In our program, My Hormone Masterclass, we do a saliva hormone panel. We ship that out to you when you sign up for the program. And it's really important that you have your data. That's great, right? Not only are you using your symptoms as one of the data points, now you actually have saliva hormone results of your actual hormone numbers, your data to reinforce what your body's data is giving you. You have two sets of data, which is great, right? Number two, you need to be educated on these patterns. There are tons of patterns of hormone imbalance that feed autoimmunity or just plain make your life hell. And so interestingly, I just talked to someone who just finished my hormone masterclass, Kate, we'll call her. I just talked to Kate today. And Kate was saying how for the last 10 years since the birth of her kids, she's been begging her doctors, and she's a very educated individual, but she's been telling her doctors that I know these headaches, I know this hair loss, or I know the symptom with the gut is linked to my hormones. And her gynecologist or her endocrinologist actually looked at her and said, you are healthier than you think. You're fine. There you go, little lady. And that for me, and she says, and I agree with her, he's a good doctor and he's a nice man, right? It's not about intention here, but we really don't train doctors on what are the patterns of hormone imbalance. We don't train them on how to test it. Even if they got it tested for you, they don't even know what the patterns of it is. And patterns refers to the relationship between the hormones. What's the relationship between your estrogen and progesterone? What's the relationship between your progesterone and testosterone? What's the relationship between your adrenal hormones and your testosterone? What is going on with your cortisol? What's the relationship between different times of cortisol throughout the day? These are big questions, big patterns that we just don't train doctors on. So, since you can't depend on doctors for that, number two is you need to train yourself on what the patterns of hormone imbalance are, right? Number three is once you learn what the patterns are, then you understand the why, right? Then you need to be educated on how do you fix those patterns, right? If that pattern is result of unstable blood sugars, how do you fix it? How do you fix it with lifestyle? How do you fix it with supplementation? And that's the thing is, I think it's really important to know that when you understand the why underneath, like that's the reason it's a root cause, then you also have your data to reinforce it. Then the how becomes easy. It's easy to do something when you know it's going to work. It's easy to do something when you know the why and it makes scientific sense to you with your own physical symptoms and your own data. Then you really understand the why, the how becomes crazy easy, right? So that's important is to really understand the why. So then the how becomes easy so that you're going to learn the how. Once you learn the how, you implement like crazy. I just taught you like 6 things to implement today. Okay. And I just taught you the why. Not only did I tell you why DIM or calcium deglucarate or sugar, blood sugar or water is good, I told you the why. And now that you understand it, the why, I also taught you the how. Now you need to implement, which is step 4. You got to implement everything that I tell you to do. Okay. And implementation is key. And number 4, see the results. Because once you start to see the results in number 4, it's so easy to have sustainability to keep doing it. Which also reminds me of another. I just did a follow up interview with Pamela. Pamela had an interview about 9 months ago, and she is recovering from her rheumatoid arthritis, and she had huge hormonal imbalances during the program. Pamela was sharing where her hormones are about 9 months later. And this is the important thing. It's like Is balancing your hormones a fly-by-night thing? You go see a doctor one time, you watch one live, you call it good? No, because hormones continue to get better and better and better over what? 6 months, 9 months, 12 months. And guess what? Do your hormones continue to change throughout your life? Yes. And here's something really important, whether it's my hormone masterclass or Transform Autoimmune. I tell everybody starting our programs this: if I do my job right, which I always do, at the end of this, I'm not giving you the answers. You have learned the skill. I have taught you the skill of how to think like me to come up with your own answers now and for the rest of your life. And that's a tall order. I mean, that is a tall order I've just given myself, but that is a promise because what I do is very different. I teach people the why, the how, right? And so that you can understand and troubleshoot through it, even if there's variations of the pattern when you retest. Pamela just rechecked her hormones like a month ago. Lo and behold, her estrogen is improving. Her low testosterone is improving. Her cortisols were all over the place, improving. But most importantly, her results are sustained. Her pain now is zero. Her pain from her rheumatoid arthritis is zero. Her fatigue is still gone 9 months later. She's working out. She's back to being an athlete again. That's what it means when you have hormone balance. Okay. That's also what it means when you have hormone balance as part of your autoimmune transformation. Okay. So for me, hormone balance fuels autoimmune turnaround and sustainability. That being said, if you're interested in learning more about my hormone masterclass, I would type hormone masterclass in chat and we'll have a team member reach out to you and give you some resources about my hormone masterclass, which is really our class that's only focused on hormone balance, which is huge. And it really has your own testing, your own data, educational modules, and it does currently include one consultation with me as well. So that's my hormone masterclass. If you're interested, write hormone masterclass in chat.